So let's talk about the psychological and emotional aspects.
Yes.
So how do burn injury impacts patients' mental health in a long term?
Yes, it affects very much because burns is a very psychological disorder. Also, problem being it is a very stressful disease.
Yes.
The the trauma which the patient goes through during the burn is one of the most painful conditions anyone can see, and it is very painful for the dressing. If a burn survivor is there, they become so sensitive to pain because of the repeated dressings, repeated pain, and it is very traumatic for them. So most of them will be having anxiety, depression, post-traumatic stress disorder. It will be very tough for them. So involving a psychologist or counselor, psychiatrist into the treatment protocol as a team, so it helps the patient a lot.
Counseling is required.
Yes, definitely it is required. It is very painful condition. So it is very traumatic for
So
them.
you told me it's very deep injury, pain is not there.
So at the time of burn,
It's not there.
because the nerve endings are dead, once that dead skin is removed, eventually it has to be removed, it will get removed, and then the normal granulation tissue will form. And this is all very painful.
Okay.
So only at the time of burn, if there is no pain, that means the skin has been completely burned. And if there is mild pain, only superficial is burned. Once it is gone, again it is hell lot of pain. It is
Oh
very,
my
very
God.
painful for the patient. So you can hear the screams outside of the burn ward. It is very scary.
And once a long term means if there is scar is present on the face or something like that, in the case of ladies or gents, that also gives it mental trauma.
Yes,
Like
yes.
every time he sees the,
It is very tough for them socially
yes,
because they are very bad, one of the very bad looking scars.
yes,
So it is very tough for them both mentally and socially. It is very difficult to cope. But if the proper scar care or scar routine is given, we can make it better. We can't completely make it disappear, but we can make it better over time.
In your career, have you made like one patient comes to you, but he's very curious about his body, skin texture, or something like that?
Yes,
In
yes.
that case, in that patient, how do you manage?
So yes, that is definitely there with young women or young females who are unmarried. They are very particular about how they look,
Yes,
how they
yes,
look.
yes.
So it is very troublesome. It is very problematic for them, and for a surgeon also, it is very difficult to treat them. So first, we'll give them counseling. Counselor plays a very good role in this, psychologist and a counselor, and then we'll give other various modalities of scar revision are there. We can get the scar revisions done. We can get a scar revision surgery, or we can improve the texture with using PRP. Patient's own blood, we take it and we centrifuge it, and this PRP, platelet rich plasma, is used to infuse into the scars, or we can give some steroid injections.
Okay.
And there are something called as fat grafting. Fat grafting. We take patient's own fat, we process it, and we make either microfat or nanofat, and these can be used to modify the texture of the scars.
Okay.
There are lasers. We can send them for lasers. And there are anyway camouflage makeups are also there. We can try to camouflage or make sure that scar is less visible. If the scars are smaller, we can excise it serially. Slowly, we can multiple stages. We can remove it surgically, or else if it is a bit larger and there is surrounding normal skin, we can use something called as a tissue expansion. We can use
Tissue expansion.
Yes, tissue expansion. If there is a scar here and there is surrounding normal tissue, we increase the size of the normal skin by using silicone balloons.
Okay.
We use silicone balloons, we increase the size of that skin, and the scar tissue is excised, and that excess skin is used to cover this area.
Okay.
So this can be done, but it is a very longer process.
For this, how many times the patient has to come for a surgery? Is a surgery required
Yes,
for
yes,
this?
that is tissue expansion is a surgery. In the first stage, we have to insert the balloon or silicone balloon. That is the first stage, and eventually, every weekly twice or weekly once, we inflate saline. We increase the size of the balloon by inserting saline into it. After 6 weeks or 4 weeks, depending on the size of the expander, once the expansion is complete, we'll wait for 4 more weeks, and second stage surgery is done. We remove the expander and we excise the scar, and we advance the growth, excess skin which has been produced, that is advanced to close the defect.
Okay. So how many times the patient has to come? Like
So it is like a multiple visits.
Multiple
So
visits. Okay.
first surgery is done. Every week the patient comes to the doctor. We have to inject saline. There are newer modalities, self-expanding tissue expansion devices are there. If the patient is well educated enough, they can do it on themselves, but it is usually not advisable. They have to visit hospital every week, sometimes twice a week. The tissue expansion is done. This is done on a period of 4 to 5 months, depending on how big the expander is. Then once this is done, and then they have to get eventually another surgery done.
it
This is
depends
a
upon the
Size. It
Yes.
basically depends on the size. If it is bigger, it will take more time. So usually it is months, period of months, over a span of months it will take.
Okay. Maximum in this case, family plays a very important role.
Yes.
What advice do you give to the family members of the patient?
See, family plays a very, very major role in the burns patient because it is more traumatic, painful, and family support is very, very important because nutrition also plays a very major role. The patient can't feed on themselves. It is very tough for them to stay motivated all the time. Some people are very strong and they get motivated all the time, but over a long duration of time, burns is a very challenging thing to go through.
Yes, it takes
So
time.
yes, it takes time. So emotional support, financial support, and nutritional support, everything should be provided by the family. Big support to the burn survivor. If the family is not there, it is very, very tough for them. The supportive family should be
Yes.
there. They should be supporting them in the nutrition. They should be rehabilitation. They have to take multiple follow-ups, multiple surgeries.
Yes, yes.
So this is something very, very important. Yet some people ignore it. But if it is there, it is very easy for the patient. Both emotionally and financially, also their support is very, very important.